Magnesium is one of the most important micronutrients for the human body, is involved in many physiological pathways, and is essential for the maintenance of normal cell and organ function. Magnesium use in women, both in terms of prevention and treatment, is extended to many health issues, ranging from PCOS to premenstrual syndrome, pregnancy and menopause and beyond. So Dr. Paulo is in studio today to discuss the effect of magnesium supplementation on women's health and well-being. Paulo, why is it that magnesium is so important?
Well, it is essential, first of all, so the body does not produce magnesium. It is the fourth most abundant mineral in the body. Okay, so it plays a role in over 600 biochemical reactions, and that ranges from the brain to the heart, to the immune system, the hormonal system. So it's just about everywhere.
Yeah.
A very important thing to remember is that the magnesium's stores are mostly in the bone, 53%, 46% is in cells, so intracellular, and only 1% is somewhere in the blood.
Okay.
In serum or in red blood cells.
Right.
That is important to know because the standard commercially available test for measuring magnesium levels is either a serum magnesium level or a red blood cell magnesium level, which is only going to measure that 1% compartment.
Yes.
Which is
oddly the smallest part.
Is oddly an indication of what actual magnesium your body may have.
So when you say that, so they're measuring what has been drawn into the blood, but they've got no sense then of what's sitting in the stores at all.
No, there are some ways, there are some so-called gold standards to measure the amount of magnesium in the other two compartments, but those are not commercially available. They are long and tedious, perhaps expensive too, so they're not practiced.
Okay.
So that's very important in determining deficiencies.
Right. So how then do we, what causes, in fact, the deficiency of magnesium, and why does it diminish in those stores?
Well, there are a number of reasons. So first of all, inadequate intake. So that would have to do with poor diet. And poor diet means, of course, many different things. Then the absorption is a major issue as well. So people with inflammatory bowel disease, people that have had gut surgery, people with celiac disease, they will not absorb properly. Specifically with women, the hormone systems that assist with absorption may become dysfunctional. And that happens in obesity, that happens in PCOS, with diabetics as well, metabolic syndrome, systemic inflammation. So anybody with rheumatoid arthritis will have lower magnesium stores, for example. All right. Then we have also to do with the transit time of the food that you consume that contains magnesium through the gut. So anything that increases that transit time, such as abuse of laxatives, for example, will also have an impact on how magnesium is absorbed. And then we have a whole lot of pharmaceutical drugs. So, antibiotics, antacids, which are very, very popular. They will all drop magnesium levels. Chemotherapy drugs, cortisone, diuretics, proton pump inhibitors, even insulin. Will cause the levels of magnesium to drop. So there's a very long list of possible factors that are involved in reducing your magnesium levels.
Right. So I mean, in terms of those deficiencies now, you've got, I imagine there would be sort of an acute deficiency and then and other forms of deficiency. What are the different types that you might be dealing with?
Okay, so there are two broad types. An acute deficiency is when the amount of magnesium in the blood reduces very quickly over a short period of time, so to speak. So that happens in eclampsia, for example, which follows preeclampsia in pregnant women, the development of blood pressure after 20 weeks of gestation. Also, it happens in people that develop involuntary movements, for example, nystagmus, which is involuntary movements of the eye. Now, these are all emergency situations. They all require intravenous magnesium, and if not treated, they will end in death. That's an acute deficiency. You need to get to an emergency room. All right. Whereas a chronic deficiency or a subclinical deficiency, in other words, a deficiency that doesn't elicit these terrible symptoms and dramatic symptoms, as you say, that kind of deficiency is developed over time. And that's a deficiency that we are talking about.
So just to clarify there, so the one is that it's your stores might be all right, but the your blood level has just dropped, plummeted. And the other one is that your stores are depleted.
Very good, actually.
Okay,
Yes, I should have explained. So the other one is that usually the bone stores, but also the intracellular stores begin to be depleted. And because there is no way of measuring it, in as far as a simple test is concerned, there are ways of trying to gauge where you would be in terms of magnesium deficiency by examining what we call modus vivendi, which is your lifestyle, basically. What you eat, your exercise, drugs that you take, you know, all the factors that I mentioned earlier.
Yes, yes. So now what is the effect of this sort of chronic or subclinical deficiency of magnesium on the body?
Well, it leads to the development of cardiovascular disease. Okay, it can lead to development of neurodegenerative conditions. So it leads to the development of many chronic conditions. And in women, it has a great impact in that it is considered to be a major factor in the development of, for example, premenstrual syndrome. Okay. Development of PCOS. Okay, the development of preterm labor as well, as well as restricting the growth of the baby during the pregnancy period.
It's quite a thing.
It's also implicated in the development of so-called menopausal symptoms.
Okay. Then, Paulo, specifically, let's talk to PMS. I mean, what's the relation there between magnesium deficiency?
Well, it has been shown that it plays a role in the development of depression during PMS. One of the important factors in PMS is the shortage of a prostaglandin known as E1, which is very important for the central nervous system. Okay. The production of that prostaglandin by the body requires magnesium. Ah, right. So in the case of magnesium deficiency, there isn't enough prostaglandin E1, and so that becomes a factor in PMS. Okay. All right. Then some of the PMS symptoms, which include depression, it includes being overweight, for example, they in turn burn up magnesium. So it's sort of a vicious
further
cycle.
Diminishes.
Correct. Okay. So the deficiency of magnesium is definitely implicated in PMS. Right. B6 also plays a very important role there, vitamin B6, and it is known through research that to have a favorable impact of supplementing magnesium for PMS factors, it requires at least 3 to 6 months supplementation. Okay, so it's a long cycle of medium
supplementation.
to long term, yeah.
So the next sort of phase in a woman's life would then be menopause. And again, you've mentioned the hormonal interaction. So all of these things are again implicated. What would be happening in menopause with a shortage or a deficiency in magnesium?
Of magnesium. So it'll play a role. It is known that a deficiency of magnesium aggravates the intensity of hot flushes, for example. Okay. All right. It also leads to lower bone mineral density. It leads to a lower vitamin D3 status. All right. It's also implicated in the development of depression post-menopausal. All right. And a magnesium deficiency in menopausal women also contributes to the development of high blood pressure post-menopausal. Okay. So it's very, very important to make sure that the magnesium stores are where they should be throughout one's life.
Right, right. So Paulo, I mean, obviously, again, the idea of supplementation is very important because we're just not getting enough of this from our diets. What are the different forms, though, of supplementation when it comes to magnesium? Because there's various sprays and powders, things you can throw in the bath with you, tablets. There's quite a broad array. I mean, are there specific, or maybe the question is there a specific supplement for a specific condition or need or lifestyle, or how do you juggle that?
I think it's not so much the form in which you get it, whether it's an oil to rub on muscles or a capsule to take. It's that magnesium is available in different basic formats, chemical formats. Okay. Some of it is, some forms of magnesium are chelated or joined to an amino acid, for example. Right. So there are different forms. There is not as much research on some of these forms as on others. Basically, the claims are that different forms seem to be better for different effects. And there are 4 areas in the body that are primarily affected by mineral supplementation in terms of magnesium, and that is the brain, the heart, the gut, and the muscles. Okay. Okay. So some will say that this form is better for brain effect. All right. I think what we need to do in this long list, there's probably about 8 different forms of magnesium, is to look at the ones that have been most studied. It's to look at bioavailability. Okay. okay, and to look at what is the intention of supplementation.
Right, right.
Okay, is it to recover the stores, in other words, to make sure that you have correct levels, which usually is a long-term thing, because that makes it simpler in terms of choosing the form of magnesium to take.
Okay. So Paulo, we've selected one called, it's Biomax Magnesium Complex, which is from Coin Healthcare via Phytoceutics. So this particular one, what form are we looking at here, and what does the study say? Okay,
so this is magnesium citrate. So magnesium citrate is the most researched form of magnesium. It has been shown to have the greatest bioavailability as well, all right? It can be used, for example, in high doses to treat constipation because it has that effect in the gut, all right? But at normal dosages, it will recover magnesium stores in the bone and inside cells. What they've done with this product, so it contains magnesium citrate, a certain amount, then it contains magnesium citrate within a liposome.
Okay.
So that form will be absorbed without having any effect on the gut.
Right.
Okay, so if there is someone who's more susceptible to the effect of magnesium citrate on the gut, then this will be a good product because some of that magnesium will have no effect on the gut. Okay. If it's enveloped in a liposome, it will be absorbed into the bloodstream.
Right, right.
Okay, and then what they've done here as well is that they've included a prebiotic.
Okay.
Okay, just for a bonus, I guess. Right? So you'll have some food for the friendly bacteria in the gut.
Okay.
Okay. So as far as a magnesium citrate product is concerned, it is a very good product. And magnesium citrate, as I said, is the most researched form, great bioavailability.
Right. So I just want to touch on something you mentioned earlier very briefly. You mentioned the importance of magnesium for gut health. But now, when you take a supplement, you don't want the magnesium in its purest form in your gut. So it needs to get into your system first to then have the impact.
Correct.
Correct?
Correct.
Okay.
Correct, yes. So in other words, when you take unprotected magnesium, in other words, not in a liposome, for example, some of it will be used in the gut, some of it will be absorbed.
Okay.
All right? By taking magnesium in a liposomal form, that fraction of the magnesium supplement can only go into the body.
Yes.
All right? Because the liposome protects it from being used in the gut.
Okay, right. That does make sense. Paulo, in terms of magnesium supplementation, is there a contraindication with anything like drugs you might be taking or people who should be particularly cautious when supplementing magnesium? Yes.
So anyone in renal failure or with heart block.
Okay.
All right, because magnesium plays a role in the electrical conduction of the heart.
Right.
So renal failure and heart block, they should consult their health practitioner.
Okay.
Then people taking antibiotics, so it may reduce the efficacy of the antibiotic.
Okay.
All right. Diuretics, anyone on diuretics requires more magnesium because diuretics cause the loss of magnesium in the urine.
Right.
Okay. Anyone taking calcium channel blockers. It's a family of high blood pressure drugs. The supplementation of magnesium may reduce the need for the calcium channel blocker, so it may lower the blood pressure. Okay. Talking about magnesium losses, when you spoke about women in menopause, the fact that the estrogen and progesterone levels drop in menopause means that magnesium is lost in the urine in greater amounts than when those hormones were present.
Right, right. So you want to up it a little bit. Paulo, where can we find this product?
I believe it's available in health shops and pharmacies.
Wonderful. Thank you so much. Some very interesting points there. Lots of stuff that I wasn't aware of. So thanks for sharing.